Let's talk about Sabrina Carpenter. She started off real young. She was in some Disney series, and then she started singing, and she's been working on her career for 8 to 10 years. She really got her big break when she opened for Taylor Swift. She is considered pretty much the pop princess now. So if you take a look at her, we've got a picture of her here when she's 18 from 2017. Well, first of all, she's a beautiful young lady, no doubt about that. But we're looking at things that could affect her when she's under the magnifying glass of Hollywood. So if you look at her eyebrows, her right eyebrow is lower than her left eyebrow. And her left eyebrow is compensating because her left upper lid is showing more of her skin. And that happens a lot when people have a little ptosis. And ptosis is a droopy lid. She's got some fullness in her cheeks that's a little bit low. And for her age, she would not have that fullness unless it was a filler. So she's already getting started doing a little bit. And we'll basically see how she does. Let's take a look at the next photo. So if we look here just a year later when she's 19, she has had a brow contour procedure. Let's look at her brow balance. Her brows are just the same, and she's got a little elevation, as she should, in the outer corner called the tail of the brow. And more interestingly and more subtle, she's had some work to her nose. If you look at her profile and you look at her tip of her nose, she's had a little work on what we call a lateral cartilage. And those are the subtle kind of things that you do if you're at this level, because it shows up in pictures. A year later, when she's 20, in 2019, you see she's got a little bit more of an adult, more sophisticated look. And sure, she's getting older, but look at her cheek area and look right below it. She's already starting to have the buccal fat removed to give her that chiseled appearance. Now, some people would say maybe if you lose some baby fat, that can happen, but your baby fat's gone by the time you're 17, 18. And this is a significant change that she's had in 1 year. And her filler has also moved down. In my opinion, she's putting in too much cheek filler that's making her cheeks look a little full because she's petite and she's beautiful and she has a very pretty smile, and it's gonna take away from her smile. And here we see when she's 21 in the year 2020 that her cheek fullness has now expanded out and she's a little widened in the cheek area. And she's showing the buccal fat below her cheek where it's been removed. So on both sides, she's got a little indentation that she did not have before. And it does frame her lips, but it also shows the disparity between her mid-face and her lower face. And then here we are when she's 22 a year later, and you can see that the fullness of the cheek has expanded all the way across the face. So her entire mid-face has filled out, making her face wider, and it also again shows the changes from the buccal fat removal. And a lot of times people will accentuate the cheeks with either a cheek implant or cheek filler, or they'll do the buccal fat. But when you do both at the same time, it makes the mid-face and the lower face not have good balance. And then here we are at age 23, another year later, and you can see that she's got so much fullness in her lower lid and her cheek area, she's starting to lose the upper part of her nasolabial fold, which is that fold that goes from your nostril to your outer lip. She used to show that, now she doesn't because of the amount of filler that she has. It's the type of look that you start to lose some of your unique features. And she's always had a unique look and a unique smile, and she's starting to lose that and look like everybody else in Hollywood. And then here we see when she's 24, she's got a lot of fullness in her cheeks, which is a little more out of proportion for her because she's very petite and she's got a beautiful smile, and her focus should be her eyes and her smile. And I think if she would take a little away from her cheeks, it would enhance her beauty. She's also, because of the weight of the fillers, she's starting to get what I call a shelf sign. So if you look below her eyelid, between her eyelid and the nasolabial fold, you see that little line. that's a demarcation of where she's having all those fillers. And it's just too much weight in her cheeks. And one thing that we've learned over the years is the filler lasts a lot longer than all the reps and the manufacturers were saying. Sometimes when I do surgery, somebody's had filler 10 years before, and I'm finding evidence of it during surgery. So it's important that if you need volume, to use natural volume and to put your tissues back where they belong before you do a lot of fillers. There's a limit of how much fillers you can use, and I think as petite as she is, she needs to start fading away from the fillers. So at this picture, when she's age 25, let's keep in mind that Hollywood has a lot of pressure. And sometimes people say Hollywood is turning into Hollyweird. And I certainly don't think that's the case here. And she's a beautiful young lady, and her career has taken off. And a lot of times people say she's an overnight success, but keep in mind, she's been working very, very hard for 10 years to have her sudden success.